Welcome everybody to Innate Interviews. My name's Dr. Haig John. I'm your host, and I've got Ron Castellucci as our guest today. I'm really excited. I've been watching a lot of the great work that he's been doing, adjusting babies, which I'm passionate about, and teaching others really the approaches to do it properly. And I just saw you were in Mexico. How did that come about? Tell us a little bit of your story. Tell us where you come from. Where do you practice, Ron?
Okay, well, I grew up in New York City,
Mm-hmm.
and I went to Logan College.
Mm-hmm.
Discovered chiropractic when I went over to New York Chiropractic College, and I just looked at the view book. At the time, they had view books, and I looked at the view book, and I thought I could do that. That looks interesting. I wanted to work with people. I started out as wanting to be an architect, so I guess understanding structure and symmetry and stuff like that was a natural connection with chiropractic. But went to St. Louis, started practicing in Boston. So I practiced in Boston for 10 years,
Mm-hmm.
and that's where I met Larry Webster.
Yeah.
Larry Webster was doing, I think they call them pediatric extravaganzas. And there was one up in Boston, actually two that I attended. And I met Larry, and I was just thought this is pretty awesome. So a lot of the things that I teach now, I learned from Larry Webster and from other people in the ICPA, like Jeannie Ohm and Peter Kevorkian was up in that area, and I
Mm-hmm. Yep.
became friends with him. So after Boston, we moved down to North Carolina. So I'm in the Asheville, Hendersonville area, which is the western part of the state. And I met Tom Gilardi a couple of years before I moved, and I thought, this guy's pretty cool. He asked me if I wanted to have or thought about teaching. Little did I know that all of the chiropractic presidents asked that same question when they talk to people. I thought it
Is
was
that
somebody
right?
special. I thought, oh my gosh, Tom Gilardi thinks I'm special. This
Absolutely.
is good, and maybe I need to go teach for him. But
Yep.
come to find out, he asked that question of everybody.
But
So
only few answer, right?
it's
Only a
only a
few
few areas.
answer.
So we moved down to actually in Western North Carolina. It's about an hour from the school,
Mm-hmm.
and so I've been in continuous practice since 1988, and I've been teaching here for I think maybe 27 years, 26 or 27 years right now. But my introduction to chiropractic was through Larry, through Jeannie Ohm, through the ICPA,
Mm.
and always loved kids. Have a passion for
Yeah.
working with
Yeah.
kids, and that's a story for another time. But here I am.
Well, I just taught a seminar at Sherman just recently, and you have a great bunch of students. And those guys, they're passionate. We had lifers come also as well. And
Excellent.
it is just great to see the passion in the chiropractors right now in the colleges. They're passionate about serving children, adjusting, and keeping that principle alive. And
Oh,
it's heartwarming because we need it. We need more chiropractors, and we've got a lot of non-chiropractors that listen to the podcast, and we need more chiropractors around the world. We need them at Sherman College. We need them trained well, and we need to get them out there. One of my missions is really having chiropractors in labor and delivery around the world.
that would be great.
And yeah, I just wrote a paper about it's just submitted to peer review at the Asian Spine Journal, and
Mm.
it was Marty Rosen that's
Oh
helping
yeah,
me get it get that submitted. And it's the role of birth trauma and the role of chiropractic care.
yeah, yeah.
And a lot of the stuff that we see starts even with adults started very early life. And I remember Jeannie Ohm. You mentioned Jeannie. I've gone to her Webster's seminar maybe a dozen times, and all the other things that she's done through the years. And I just remember her first time I ever saw her was fresh in school, and just talking about the C sections and the
Yeah.
vacuum extractions is like a noose. My friend Armo Bernier used to talk about that. Babies need the care and mommies big time, so the pelvis can open up and that whole system can work. We have hopefully see fewer C-sections, healthier births. That's what my mission is. When we start talking about it, you hear me, I get passionate about it. And I love passionate people that really want to enhance the health and wellness of our society. And I really thank you for all your hard work.
Yeah. Well, you mentioned that you have non-chiropractors on this podcast.
Yeah,
And if you think about the stress of being born,
that's right.
and when the baby comes through the birth canal, that's stressful as it is. But then we call them interventions. So doctors meaning well, midwives meaning well, they're assisting mom and assisting the birth process. But that little neck is attached to a big head that pops out, and there's a certain amount of twisting and handling of the baby, and even the most gentle handling of that child is going to create some stress in the neck, which creates what we call a subluxation. And having children checked from the moment that they're born or shortly thereafter ensures that their spine is going to grow in a healthy, more vital way. So, and that's so important, as you know.
Yeah.
Everything in the body is controlled by the brain, by nerves that pass between the bones of the spine. I mean, that's basic understanding of how our body functions. The very top bones of the neck are most vulnerable during the birth process. And so I tell people that all those nerves have to pass through those top few vertebrae, and the birth process has its greatest effect there. So it would be wonderful if all babies had that opportunity to get checked.
Well, in our birth story with my daughter, she
Yeah.
was sunny side up. I
Oh, wow.
adjusted my wife as much as humanly possible, and that's the presentation. I think we get these things as gifts so we can teach others. When things happen, it's always the chiropractor's child in some way,
Yeah,
and
yeah.
when she was first, we were doing a home birth and we transferred to the hospital. My wife samurai pushed for 10 hours
Oh my
plus. Okay. Baby's caught like this in her pubic bone. And when she first came out, she wasn't breathing very well.
God. Mm.
And, I'm in protection mode, protecting my family.
Yeah, yeah.
We were in a hospital when we were home just recently, and the nurse said, "Come and adjust your baby, Dr. Haig." And
Wow.
I realized the whole room was filled with my patients. They all knew what I'd been doing, my talks in my office forever. They know what we believe in. And she said, "Come over here." I didn't even see her face. I'm just protecting my family. And I adjusted my daughter's atlas, and I could just see her chest rise. Just like that, from where she was labored breathing. And that one adjustment was a life-saving but transformative. And I've always been a family chiropractor. I've always been adjusting babies. But when it comes and you see it with your own child,
Mm.
that it was that moment of, I'm on the right path.
Yeah.
This is what we're meant to be
Wow,
doing.
that's
Absolutely.
amazing. I like that.
So that's where our
It's
motto, you
good.
see, save the babies back here. A
Same
better
thing.
world begins with well-adjusted babies. This is our
Of
movie.
course.
We have part 2 coming out. We're going to be filming very, very soon at Life University. So,
Yeah. Well, you see the movement that's going on today.
yes.
Politics aside, but you see the basic premise is that we want to have people more healthy in our country,
Yeah.
and having that beginning of life where you're connected and you begin life in it with a healthy spine and a healthy body is going to ensure that you're going to have a healthier, more vital life. So yeah, absolutely, absolutely agree with you.
When you say that, because realize some of this birth trauma, I have it on my initial intake for adults even. Was there any trauma in your birth? And most people will say, no, nothing. I mean,
No.
my mother complained about my birth every birthday I ever had and every Christmas, right? They knocked her out.
Yeah.
And then she woke up and she's trying to hold a baby, right? With the anesthesia, she couldn't even hold me. But we have really no idea how it came out here. And very likely it was a forceps,
Yeah.
right?
Yeah.
You think about that trauma on that neck of a newborn that has never had to hold the weight of its own head, right? Being pulled out of one's mother.
Mm.
And that's the industrialization of birth, right?
Oh, I
That's where we're in
agree.
this industrial revolution,
Yeah.
right?
Yeah.
So have you seen many of those traumas in practice? Or I'm sure you have. This is a baited
Yeah.
question. And
Yeah.
what would be your first approach? What do you teach students in those situations?
Well, we want to give people an understanding that birth trauma is not a broken arm or a blood vessel. That's it's not trauma in a sense that we understand trauma, but the stress and pressure of going through the birth canal and the twisting and turning and all the handling that happens, however well intentioned, will affect the baby spine. I always say that the head pops out first, and then there's a little tiny neck that is taking a lot of the brunt of the interventions that are happening. And
Mhm.
so when I ask that question, I ask the same question of my adult patients,
Mhm.
and many of them don't remember. But if they think back, some simple things like learning how to walk.
Yeah.
You fall on your bottom 100 times a day. You learn how to ride a bike. You learn how to ride a skateboard. So yes, the birth trauma sometimes is hard to pinpoint. Like you have that story. Who remembers their their birth.
Mhm.
But understanding and seeing a film or having an understanding of the process, the way it happens, you can naturally see the challenges that baby's going to have with their spine. But if you think about all the things that we've done when we were kids,
Right.
I mean, there are things that we've done that we were afraid to tell mom
Oh
because
yeah.
we would get in trouble, and we got hurt or bumped around. So I think people recognize that the potential, and since everybody's been born, everybody has the potential of having subluxations in their spine.
You hit on a really good point. It's not just newborns, right? As
Yeah.
kids are growing up, they fall on the bottom 100 times. My kids, as soon as they got the height of the dining room table, they were hitting the table. They fall
Yeah.
off the bed. It
Yeah.
happens. They roll off the couch.
Mhm.
And then being a kid, bouncing off the walls, falling out of trees, all those
Yeah.
things. We want to make sure they have a healthy vertebral system. So the neurological system has a proper communication. In chiropractic, we say from above down and the inside out. So
Exactly.
that communication from that life force, we call innate, we call it spirit, we call it life itself, that has to communicate well. The subluxation, that subluxation inhibits that, can inhibit that function, which can
Mm.
inhibit its growth, inhibit the function of the organs, because that's where the life is transmitted through the system. So for the people listening, we're not just talking about newborns, it's children, toddlers, teenagers,
Yeah.
adults, grandma and grandpa, right?
Yeah. Yeah. Yeah, and you mentioned like the children and whatnot. Just think back. As a child, we did all kinds of goofy things. And what the subluxation does is I like to describe it as a disconnect.
Okay.
The disconnect between the brain and the body, and a subluxation always has to affect the neurology or the nerves, because the nerves are so intimately related with the spine. And so I always tell my patients and our students, we try to teach our students to communicate well to their patients, that everything in your body is controlled by your brain, by nerves that pass between the bones of the spine. And when those misalign, the first thing that happens, it interferes with the neurology, and the function of the body is affected. And often takes years before you start experiencing some of the damage that has occurred from
Right.
the subluxation. It's like any disease, any condition. If you think about even a simple cavity, it's been in there for years before you actually feel it. And
Mhm.
so subluxations, while it's not a disease, is similar in that process.
Well, D.D. Palmer said, called it dis-ease, right? The body is not at ease.
Mm,
And when it's not at ease, we have less function. And when we look at that subluxation process, the very important part you mentioned, a misalignment doesn't have a nerve component. The subluxation has a nerve component, actually affects the neurology.
yeah.
And if just say if we have a rental property, it had a drip of just a slow drip in the faucet, but that cost us hundreds of dollars, right, a month until we figured it out. If we have 1% less function, say, go into the liver or the pancreas for 30 years, the probability of dis-ease, less function, is much greater.
Yeah.
And that's when we talk about in chiropractic, when we actually talk about health of what we're talking about. I'm not the healer, the healer's within you. We separate, we allow the processes to do what they're meant to do properly. Is that what we're talking about?
Yeah, exactly. Yeah. You know, it's interesting. A class I was just teaching today, we talk about primitive reflexes in an infant. And so these, I won't go into the detail, but primitive reflexes are things that happen, that reflexes that an infant has to allow them to interact with the environment.
Yeah.
You know, and as their nervous system becomes more mature, these reflexes go away. Sometimes they don't go away. And sometimes the reflex remains. And there's a reflex that happens in the lower part of a child's back that causes the muscles to contract. And so you might have a child who's sitting in first grade, and this child can't sit still because every time they lean back against the chair, they activate this reflex. So one of the things that we teach our students is that we first need to correct the subluxation, get the neurology functioning better, before we do anything about the reflex. And so the really cool thing is that when we adjust the subluxations, the neurology becomes more normal and we see the reflex go away, which is showing us that we are affecting the central nervous system, the brain, and the nervous system of that child. And we could actually measure that, which is really cool things that we're seeing today in chiropractic. So it's not so much I don't feel the subluxations with my hands. I could literally see the changes in the neurology through some of these reflexes as they change. Now, our intention is not to correct the reflex, is to correct the subluxation, but this is an insight into the improvement of the nervous system.
What do you use to, like you were just saying, the tools and technology you use to measure those things? Maybe you could tell us a few of those.
Well, the reflexes are just something that we observe
in the test, right?
You know, and we observe that. But on a daily basis, we use something called advanced muscle palpation. And I've taken that from, it started out with Reggie Gold. He called it vertebrae because you can palpate or feel the muscles in the spine, and the muscles around the spine will attempt to keep the spine, the vertebrae, in their proper position. And when they're not in their proper position, the muscles will respond to that. We call that proprioception. And that's just your brain's ability to know where all the joints are supposed to be. And so, so I teach what's called Touchpoints, which is a system of palpating the muscles of the spine to know if there's subluxation, like in an infant spine. So you and I know that an infant, it's really difficult to do some of the exams and get, you know, that we would do in our adult patients. We're not going to do x-rays on a 2-day-old child. You know, some of the other things we do, we can't, because we have to sit the child up or have the child walk or stand. And so muscle palpation becomes an excellent tool to find the subluxation. And that's the main thing that I teach in my seminars, is this touch points muscle palpation. And we also teach, you know, some other analytical tools, but that's a primary tool that I use for the real little ones.
Well, and you know, it's such an important thing too, is that these God-given tools we have of refining our touch and, you know, spending the time as a chiropractor. When I was in school, we had a lot of great mentors around, and Reggie being one of them, Pasquale Sarasoli, James Sigafus, all my mentors. And you know, that's one of they said is you absolutely have to refine your touch.
Absolutely.
And it is such a big deal. Thank you for touching on that.
We've hung out with the same people.
That
are familiar names, but the sense of touch, and the more you do it, the more refined it is.
And you trust it. That's when you have to trust it.
Absolutely. Yeah. And you know, you can really teach Well, we don't teach moms how to adjust the baby's spine, but when I find some of the findings that are very clear to me, I'll ask mom, "Hey, mom, can you feel this? Or do you
Mhm.
see this?" So
Yeah.
moms get an understanding of some of the things that we're looking at to determine if their child actually is subluxated,
Yeah.
which is really cool. It's cool to build that relationship and that connection with mom, and so mom has a better feeling and understanding about what we're doing.
That's I do that quite a bit in my office too, is can you feel this? Do you see the difference? They can't feel a short leg. We start off first quarter checking legs, but when they could see motion or see their child, wow, we can move their leg better. Their pelvis is moving better. They're walking pigeon-toed on one side. Now they're walking straight. You
Mhm.
know, those things are tremendous, really. And that's where that communication is of the practitioner, and also getting the moms and dads involved. I always got to include dad, because one of my missions is getting dads into birthing and being a part of that whole thing, because the system right now pushes dad out of the way and
Right,
treats
right.
mom like she doesn't really know anything. I want to empower families, really. And I think a lot of the education as chiropractors we've been doing, and I know you have, I have, is really empowering the family as well. I always say, be the smartest person in the room. Do your research, and
Absolutely.
Jeannie Ohm was really big on that as well,
Yeah.
and she taught me a lot. Absolutely amazing. I could sit and listen to her all day. I want to go listen to some of her tapes later on.
Well, you mentioned it earlier when you were describing this experience with your child.
Hmm.
You were saying that you went into protective mode, and one of the
Right.
things that Jeannie mentioned, and I think she did an article on this in Pathways magazine, talking about protecting the cave.
Hmm.
And so that's dad's job.
Yeah.
Dad's job is,
Yeah.
taking care of mom and that type of thing. Let mom do what she needs to do, but dad's job is to protect the cave. Should know what the birth plan is, should know what mom's wishes are,
Hmm.
supporting mom, but also protecting his family
Yeah.
and that whole process. And so she called it protecting the cave,
Yeah.
and I love it. The dads are so important, and you're right; they're oftentimes left out of that process.
Well, I remember her doing that live. I've seen her even talk about it multiple times,
Yeah.
and really, it was empowering for me as a father,
Mm.
of just saying, you know what, in a way, if Jeannie said it's okay, I'm doing what Jeannie
Yeah.
says. But and going back a little bit more than just that, adjust your baby. I'm standing guard that she doesn't get any injections and everything sting out of her body, and I'm guarding this little baby, and they made us go into the NICU, and same situation. I'm saying what I don't want, and then this is how we're served in chiropractic. Again, all of the NICU nurses were my patients,
Hmm.
except one, and I went to high school with her, and she was a good friend.
Yeah. Yeah.
And your baby's safe. Nothing's going to happen to her. No shots, no vitamin K, none of this. We've got you, doc. Okay. And to me, it was that a life of service just led to that moment. That's all I needed. All
Right.
the investment of energy of serving others really led to that one moment of that moment feeling served from innate, right?
Yeah. So you mentioned there are others on the call, non chiropractors,
Yeah.
right? And
Mm-hmm.
so our second child,
Mm-hmm.
when she was born, there was a tear of an artery
Mm.
that my wife experienced,
Yeah.
and you hear the word stat,
Oof.
and it's like, okay, we're in emergency mode right here.
Yeah.
Now everything turned out well, but that's what they do best, right? So, but we need to be involved in every other aspect
Yeah.
of that experience, right? So yeah, that's protecting the cave.
Well, this isn't anything against that medical system. I
Yeah,
mean, they were saving lives. The first thing I asked is baby safe? Is mommy safe? Everybody's monitored well. The number one emergency system in the world is what we have in the
yeah,
United States. And thank goodness it's there. And for my wife, first baby, she did feel more comfortable. Okay, we're in this setting. She was more at ease. I was I was more frantic, but that system, and the men and women that are, the medical doctors and the nurses, they are angels and they really want to help. And the more we educate, the fewer, what I'd like to see is fewer elective C-sections
Yeah.
and healthier births.
Yeah.
And that comes from educating families as well.
Oh,
And,
yeah.
you know
Mhm.
do you talk about education to patients, to your students?
My students, absolutely,
Yeah.
absolutely. In fact, I teach two communications classes here at Sherman,
Hmm.
in addition to two pediatric classes. And we talk about how do we communicate to our patients, how do
Hmm.
we communicate the concept. So we don't want to say don't. We want to be positive about what we do. In chiropractic, give people an understanding of how the body works and what
Hmm.
our role is.
Yeah.
And we have a very important role. And yes, there are folks who would come to the chiropractor for everything. And that's
Hmm.
good. You want to keep your body functioning properly. But we need to teach people about chiropractic, and we definitely have to have a good communication system within our office. So yeah,
Yeah.
that's a big part of what I do here at Sherman.
That's wonderful, and that is so important for the public and for the practitioner as well. I would love to say every child we've adjusted in our office and every pregnant mother stayed their whole life, but we have some moms that they come in while they're pregnant. The first couple of months they get the baby adjusted because they know how important that is, and then I might not see them till the next baby comes, no
Yeah,
matter how much we educate, right?
yeah.
At least they're doing that big part, I think, is very, very valuable.
Oh, absolutely. Getting that adjustment is going to be incredible, change a person's life. Whether a person stays over a lifetime, that's I guess as they understand chiropractic and they know what we do and what
Yeah.
the experience is, more and more we're seeing that.
Yeah.
I think with this pandemic that we had, I think more and more people are seeking. I don't want to say alternative because chiropractic is not necessarily alternative,
That's right.
but they're seeking ways of keeping their body healthy
Yeah.
because they saw that people who had, they call them comorbidities, right? So people who did not have the best of health suffered the most. And so I think people are looking at, well, how do we stay healthy? How
Yeah.
do we keep our body healthy and vital? And I think they're turning to chiropractic and they're seeing some of the benefits, the great benefits that we have. So,
Absolutely.
yeah.
And we've been preaching it for a long time. And, people are starting to, I'm not saying just starting, it's been a big movement towards chiropractic a long time, but
Yeah.
now people are questioning things and maybe they've gotten bad advice before from people. Oh, you shouldn't do this, go to the chiropractor,
Yeah.
which I think is terrible advice. But then they say, maybe let me try it. And I hear that story quite often, one bad experience, and they tell 50 people, but ultimately, that's it's hearsay. So
Yeah.
it's good to see the movement towards it. And you touched on something earlier, and I've been seeing you quite a bit in Mexico. The Mexican schools, there's Unave and Unavet in Mexico City. I love them
Yeah.
dearly, and I've spoken at both of them myself,
Uh-huh.
and adjusted a lot of them, and did adjusting seminar. And so you were just in Mexico, is
I
that right?
was. Yes.
Can you
Yeah.
tell us a little bit about that?
Well, it's a seminar so I teach for the ICPA,
Okay.
International
Yep.
Chiropractic Pediatric Association.
Mm-hmm.
And so I have a 12-hour seminar that I teach with them. But I also do a seminar on my own. I try to do these seminars in places that ICPA hasn't been or would like to go, and maybe I can plant seeds, which I love doing. Bringing more of the ICPA seminars to this group.
Mm-hmm.
But I taught a seminar in Mexico City about 4 years ago. I think it was 2020,
Mm-hmm.
and it was a great experience. And this group wanted to bring me back, and so I was in Mexico City, ate tacos, and hung out with some great chiropractors. The Mexican chiropractors, they don't get the philosophy of chiropractic in UNEVE. UNEVE, by the way, is one of the largest chiropractic schools in the world.
It is.
Yeah, I think it's part of the public university system. They will go to school right out of high school, and they do 5 years, I think. Is that the way it goes?
It's a full program, undergrad through the graduate school. It's a 5-year program.
Yeah. And they're very passionate and very hungry for this type of teaching. And so we had a great group. There was about 60 chiropractors and 12 students. And we just had a great time. It's interesting, the Mexican chiropractors and a lot of chiropractors outside of the United States, they don't learn some of the same things that we do. And so they're really hungry for that information, that philosophy, and even some of the adjusting techniques that we teach. So yeah, it was a great experience. Like I said, tacos, and they took good care of me.
I miss our Mexican brothers and sisters down there. I haven't been down in a little while.
Yeah.
And the seminars we've done were absolutely great, and such a passion out of the Latin chiropractors, south of our borders as well. But same with Brazil. We're seeing Brazil just on fire, and some great chiropractors down there. And so we're planning a Brazilian seminar really soon too.
Yeah, I was in Chile, Santiago, in November. I've taught seminars in Lima, Peru, and Argentina. And I will tell you that, I don't know, maybe it's, our Latin brothers and sisters are, in Latin America, very passionate about lots of things. And when you see that funneled through chiropractic, it is just so refreshing.
It is
so refreshing.
Yeah, it's amazing. And I'm so happy to seeing, chiropractic thrive, which means people are thriving.
Yeah.
Dee Dee Palmer said it's the denizens of the earth that deserve chiropractic care. So get out there and take care of the people.
Absolutely.
We've had the Mexican chiropractors and the Brazilian as well. Were on our they used to come on our podcast quite often, and we would do it in Spanish and English.
Nice.
And it turned into quite a bit trying to translate the whole time. So we just put Spanish subtitles on there. But the questions and the amazing answers we would get shows the passion and the principle being so strong. I say south of our borders, it's really all of chiropractic. I'm seeing it really blossom now. But in the Latin schools and the Latin chiropractors, absolutely, where we're not always in contact, or we're different languages, we're not hearing it. Their passion is strong, and their principles are strong, and the people of those countries are getting chiropractic the way it's meant to be, which is exciting.
They really are. I was very excited about that. One of the things that I brought up to the group, I said, why don't we make a goal of making Mexico one of the best places in the world for children to get chiropractic. And boy, they were really excited about that. It's quite a lofty goal, but hey, we got to plant the seeds.
Absolutely.
Plant the seeds.
That's a great mission. Mission. Ron, thank you so much for joining me today. I'm inspired. I feel excited. I'm not in the office today, but I can't wait to get in tomorrow to take care of people. And you excited me and, ignited my passion today, and I appreciate you.
Excellent. I appreciate being on. Yeah.
Well, sometime maybe you can join us on our philosophy. It's Synapse Philosophy. This is our shameless plug. Synapse Philosophy podcast. We do it live on Tuesday nights, 8 p.m. Eastern. Okay. And the code is 33 1895 1895. It's not a hard Zoom code to remember, everybody, but I'll put in the links. And but everyone has a chance to share. And if especially students, or we've got a lot of gray beards on there too, that we have questions. We broke it down. The old guys taught me in the day that we need to read this and break it down. You can quote anything, but until you understand it, it means nothing. Right. So we break down the green books. We're on Dee Dee Palmer's 1910 book. We're on page 519. And I think we may have read more of Dee Dee Palmer than 99% of the chiropractors living. The old guys read this stuff.
Yeah.
So we're getting this. We put it on MP3 too, so people can listen. And a lot of the European chiropractors and students listen because the time zone's different.
Sure.
So I appreciate you being on here because we'll also post it into that page as well, and
Excellent.
inspiring chiropractors around the world and teaching them and show them how to take care of babies. You're changing the world yourself, and we appreciate you.
Sounds good. I appreciate you too.
Well, thank you, everybody, and thank you, Dr. Ron.
Yes, sir.